Cellulitis and erysipelas are both acute bacterial infections that affect the skin. They are often confused due to their similar symptoms and appearance. However, they are distinct conditions with unique characteristics. Cellulitis typically involves the deeper layers of the skin and subcutaneous tissues. Erysipelas, on the other hand, is an infection of the upper dermis and superficial lymphatics. Both conditions are primarily caused by bacteria, with group A Streptococcus and Staphylococcus aureus being the most common culprits. While cellulitis can affect any part of the body, erysipelas usually appears on the face and legs. Recognizing the distinctions between these two infections is crucial for effective treatment and management. In this essay, we will explore the differences between cellulitis and erysipelas, covering definitions, causes, clinical presentations, diagnostic methods, complications, management strategies, risk factors, differentiation from other conditions, and prevention. By the end, you will have a comprehensive understanding of these skin infections and how to address them. Understanding these key differences will help both healthcare providers and patients better manage and treat these conditions, ensuring quicker recovery and fewer complications. The primary cause of both cellulitis and erysipelas is bacterial infection. Common bacteria include group A Streptococcus and Staphylococcus aureus. They enter through skin breaks like cuts or insect bites. Once inside, they cause inflammation and infection. Cellulitis often starts in deeper skin layers. Erysipelas starts in the upper dermis and spreads. Diabetes and obesity can increase the risk. Proper wound care and hygiene are crucial for prevention. The clinical presentations of cellulitis and erysipelas have notable differences. Cellulitis often presents as a red, swollen, and warm area on the skin. The affected area may also be painful and tender to touch. Erysipelas manifests as a raised, well-demarcated area of redness. The infected area typically has a shiny appearance and is more superficial. Patients may also experience fever, chills, and general malaise. Both conditions can cause lymphangitis, with red streaks extending from the infected area. Recognizing these clinical features is crucial for timely and accurate diagnosis. Diagnosing cellulitis and erysipelas primarily involves clinical examination and patient history. Physicians look for characteristic signs such as redness, swelling, warmth, and pain in the affected area. However, differentiating between the two can sometimes be challenging due to overlapping symptoms. In some cases, additional tests may be necessary to confirm the diagnosis. Blood tests can help identify any systemic infection and inflammation markers like elevated white blood cells and C-reactive protein. Cultures from the affected skin area or any purulent material can also identify the causative bacteria, guiding appropriate antibiotic therapy. Imaging studies such as ultrasound can be useful to assess the extent of the infection and differentiate it from other conditions like deep vein thrombosis or abscesses. MRI and CT scans are rarely needed, but can be helpful in complicated cases where deeper tissue involvement is suspected. A thorough diagnostic approach ensures that patients receive the correct treatment promptly. Differentiating between cellulitis and erysipelas is vital, as the management and potential complications of each condition can vary significantly. Section 5. Potential complications. Both cellulitis and erysipelas can lead to several complications if not treated promptly and effectively. For cellulitis, some of the most common complications include abscess formation, chronic swelling, and lymphangitis. Abscesses may require surgical drainage, while chronic swelling can lead to lymphedema, a condition characterized by persistent fluid retention and tissue swelling. Erysipelas can also result in serious complications. One of the most significant is the spread of infection to other parts of the body, leading to sepsis, a potentially life-threatening condition. Recurrent episodes of erysipelas can cause chronic lymphedema, similar to cellulitis. Additionally, post-streptococcal glomerulonephritis, a kidney condition, can occur following a streptococcal infection. In both conditions, the risk of complications increases with delayed treatment, or if the patient has underlying health issues like diabetes, immunosuppression, or peripheral vascular disease. Early recognition and appropriate management are crucial to prevent these adverse outcomes. Understanding the potential complications underscores the importance of early diagnosis and treatment. Patients should seek medical attention promptly if they suspect an infection to avoid these severe consequences. Section 6. Management strategies. Effective management of cellulitis and erysipelas involves prompt antibiotic therapy and supportive care. The choice of antibiotics depends on the severity of the infection and the suspected causative organism. For mild to moderate cases, oral antibiotics like penicillin or cephalexin are commonly prescribed. In more severe cases, intravenous antibiotics like ceftriaxone or vancomycin may be required. Supportive care includes measures to reduce pain and inflammation. Elevating the affected limb can help reduce swelling and discomfort. Warm compresses may be recommended to promote drainage. Surgical intervention may be necessary to drain an abscess. This is important to prevent the spread of infection. Section 7. Risk factors. Several risk factors can increase the likelihood of developing cellulitis and erysipelas. For cellulitis, common risk factors include skin trauma, such as cuts, abrasions, or insect bites. Pre-existing skin conditions like eczema or athlete's foot can also predispose individuals to infection. Chronic illnesses like diabetes and obesity impair skin integrity and immune function, making infections more likely. Erysipelas shares many of these risk factors but also has some unique ones. A history of streptococcal throat infections can increase the risk, as the bacteria can spread to the skin. Conditions that cause lymphatic obstruction or impaired drainage, such as previous surgery or radiation therapy, are also significant risk factors for erysipelas. Age is another important factor, with older adults being more susceptible to both conditions due to thinner skin and a weakened immune system. Immunocompromised individuals, whether due to chronic illness, medications, or conditions like HIV, are at a higher risk of developing both cellulitis and erysipelas. Understanding these risk factors can help in identifying at-risk individuals and implementing preventive measures to reduce the incidence of these infections. Section 8. Differentiation from other conditions. Differentiating cellulitis and erysipelas from other conditions is crucial. Conditions like deep vein thrombosis and contact dermatitis can present with overlapping symptoms. Deep vein thrombosis can cause leg swelling and redness, similar to cellulitis. However, DVT typically lacks the warmth and tenderness seen in cellulitis. Ultrasound imaging can help distinguish between these conditions. Contact dermatitis usually follows exposure to an irritant or allergen. Necrotizing fasciitis spreads rapidly and causes severe pain. Early surgical intervention is critical for necrotizing fasciitis. Section 9. Prevention and control. Preventing cellulitis and erysipelas involves several strategies aimed at reducing the risk of bacterial infection. Good skincare and hygiene are fundamental. Clean any cuts or abrasions thoroughly with soap and water, and cover them with a sterile bandage to prevent bacterial entry. Moisturizing the skin can help maintain its integrity, reducing the risk of cracks and fissures where bacteria can enter. For individuals with chronic skin conditions like eczema, managing the condition effectively can lower the risk of secondary infections. Patients with recurrent infections may benefit from long-term antibiotic prophylaxis, especially if they have underlying conditions that predispose them to infections. For those with diabetes, good blood sugar control is essential to maintaining skin health and preventing infections. Educating patients about the importance of early treatment and proper wound care can significantly reduce the incidence of cellulitis and erysipelas. Regular follow-up with healthcare providers can also help in monitoring and managing risk factors effectively. Section 10. Key clinical insights. For healthcare providers, understanding the differences between cellulitis and erysipelas is crucial for effective treatment. Recognizing the distinct clinical presentations and risk factors can guide appropriate diagnostic tests and management strategies. Prompt antibiotic therapy and supportive care are essential to prevent complications and ensure full recovery. For patients, awareness of the signs and symptoms of these conditions can lead to earlier treatment and better outcomes. Knowing the risk factors and taking preventive measures can significantly reduce the likelihood of developing these infections. Good skincare, hygiene, and managing underlying health conditions are key steps in prevention. Both providers and patients must work together to ensure timely diagnosis and treatment. Education and awareness are pivotal in managing and preventing cellulitis and erysipelas effectively. Section 11. Conclusion. Cellulitis and erysipelas are common skin infections with overlapping but distinct features. Understanding the differences in their clinical presentations, causes, diagnostic approaches, and management strategies is essential for effective treatment and prevention. Early recognition and appropriate intervention can prevent complications and promote quicker recovery. By maintaining good skin care, managing underlying health conditions, and seeking prompt medical attention for any signs of infection, individuals can significantly reduce their risk of developing cellulitis and erysipelas. Healthcare providers play a critical role in educating patients and providing comprehensive care to manage these conditions effectively. In conclusion, awareness and education are key to managing and preventing cellulitis and erysipelas. With proper care and timely treatment, these infections can be effectively controlled, ensuring better health outcomes for all.